So there used to be beta blockers which were used very commonly in treating high blood pressure. They have kind of gone out of favor because it was realized that despite reducing the peripheral blood pressure, they do not reduce the central aortic pressure too much. And the second thing is that there was some new onset diabetes which was seen with them. So their utilization, especially the older beta blockers like Inderal and Atenolol, today lesser and lesser people are being prescribed. You have better vasodilating beta blockers which are like Nebivolol, Bisoprolol, which are being prescribed for high blood pressure. So these are analogs. The people in the research labs will continue to make some molecular changes so that their effects change, so that we don't have the bad of any drug. It is said that even breathing air and drinking water can have some damage if you do it in excess. So these chemicals, you need to balance out, you need to titrate them, and you need to have an effective control, and leave this to your physician to decide. But as far as an individual is concerned, my thumb rule remedy for every hypertensive is, number one, take less salt. Look for hidden salt. Look for salt in things which you don't look at, like achar खा लिया, एक आम का अचार खा लिया, it's very tasty, but एक खा लिया तो एक महीने का परहेज आपका बर्बाद हो गया. You look for baked food. Baked food has baking soda which has sodium, so you avoid it. You look at preserved food, jam is sweet. Now if I tell somebody jam मत खाइए उसमें नमक होता है, people think पगला गया. But the fact is, to preserve that jam, you need to put salt. So you need to understand these hidden sources of salt and try to, as a family, I would all say that ये जिम्मेवारी थोड़ी गृहिणियों की है. Because गृहिणी जो होती है, वो एक तरह से she sets the tone for the family. And कुछ गलत आदतें हो जाती हैं. Like somebody wants कि भाई मेरे को नमक ज़्यादा चाहिए, और I want every evening I want French fries. भाई चलते गए कार में चलना है, अरे मैकडॉनल्ड में खड़े हुए थोड़ा French fries ले. अब नमक गया, तेल गया, स्टार्च गया, 3 चीज़ें गई. अब आपने तो कहा यार मेरे को तो कार चलानी थी 1 घंटा, तो मैंने कहा थोड़ा चलाते हुए चलते हैं. But these are things which the lady of the house can actually set right, because if she understands, she should not pander to her children. A lot of people come to me, childhood obesity is getting rampant, childhood hypertension is assuming huge proportions in India. And a lot of people come and say, क्या करें डॉक्टर साहब, बच्चे सुनते नहीं. बच्चों को सुनने से नहीं होगा, बच्चों को समझाना पड़ेगा, बच्चों को आपको रिस्क दिखाने पड़ेंगे. हम सब सोचते हैं कि हमारे नेबर को प्रॉब्लम हो सकती है, कोई नहीं सोचता कि हमें स्वयं को हो सकती है या हमारे घर में किसी को हो सकती है. So we need to change a few things. We need to change our salt intake, we need to change our oil intake. You ask which oil? Remember, whenever it is whenever we are using saturated fat or a reused fat, it is going to be bad for you. So any oil which is coming, which is like saturated hydrogenated oil, is very bad. So dalda are very bad. What are good are oils which are high in, which are polyunsaturated or monounsaturated. They are, rather the unsaturated oils are better for you. They can be any amount. The second oil which is good is oil which is high in omega-3 fatty acids, which come like in oils which are coming from fatty fish, which is in the cold area, like in the Arctics. That is good for you. No, we can't do that. If I tell people to change to olive oil, they have economic compulsions which do not allow them to switch to olive oil. Firstly, the taste is different. There are so many families which still use deep frying in mustard oil. If you look at our subcontinent, we have different food tastes in different places. Palm oil is used in places for deep frying. So what I say is that firstly, whatever oil you use minimum. Cook your food in water. Use oil with a dropper, not with a teaspoon, not with a tablespoon. Use it with a dropper. Use it for the flavor. Take longer to cook your food, it doesn't matter. It doesn't matter because food has its own oil. And then if you're using in such limited quantity, try to use more of things like olive oil or rice canola oil. These are, and because they are so, they can be expensive, and you can have, one oil has got something good, so other oil has got something good. Either you can mix the oil or you can rotate the oils. So even if you have to rotate a multiple of oils, so you will not get, N3, N6 variation, you will have less of trans fats. So use these oils in sequence, but avoid something which is saturated, and use minimal amount of oil. So that is, and please let us tell everybody, we are the only unregulated market now globally. You go to the US, you cannot go and pick up a samosa whose oil and trans fat content you do not know. Everything will have a trans fat content which is specified. We've got nothing against halwais, but they have to understand that they need to make things which are healthier for us to eat. So we need to educate. It has to be a national objective. Now at least they have started writing on preserved and packed food as to how much of trans fats there are. So trans fats are bad, excessively saturated are bad. Every other oil which is mono or polyunsaturated has some good and some not so good. So rather than use excess of one, I would say rotate them, because it's very difficult to mix, then flavors become different. So rotate them, it will be good for your palate. The children and the other members of the family will also think that there is some new taste today. So work on that.
Nowadays, Dr. Saab, bureau of
sodium salts are available, are they same?
Yes, sir.
Low sodium
No,
salts?
do not try low sodium salts.
Yes, sir.
What are the symptoms of a deteriorating heart?
No, sir, there are many cardinal symptoms of heart disease. The cardinal symptoms of heart disease are dyspnea or shortness of breath, angina, which is pain in the chest, palpitation. I will explain, sir. Actually, Dr. Chaturvedi told me to use this presentation, otherwise I had a presentation which would have covered that, but we have limited time, maybe in the next interaction we can do that. Fatigue, palpitations, and syncope, which is falling unconscious. Let's come one by one. Shortness of breath is called dyspnea. Shortness of breath which is more when one lies down and less when one sits up. This particular phenomena is called orthopnea, which means that you are more comfortable when sitting up. This is typical of heart disease. It usually comes from a back pressure of blood in the lungs. And because when you lie down, this gets redistributed and tends to flood the lungs. So this is one of the cardinal symptoms of heart disease is shortness of breath. Usually comes from a failing or a weakening heart. Less blood supply is called angina. Again, it is 1778. William Heberden gave the first description of angina. Let us look at his description. He described a middle-aged, heavy-set man who has been taken to smoke cigarettes on a cold, wintry afternoon after a heavy meal, carrying a heavy load, walks uphill. After some time, he observes an abnormal sensation in his chest. Now this sensation is usually in the form of a pressure. It is usually in the form of heaviness. Remember, sir, when you get injured on, say, your hand, your pain is exactly at your hand. Because this is pain which is coming from nerves which are in the dermatomyotome, which means from the skin, the muscle, and the nerve distribution is specific. When you have, if you remember the time any of you had appendicitis, the pain does not start on the right side in the right iliac fossa, it can start around the umbilicus. Because pain which is coming from viscera is poorly localized. So that is again, so when he says an abnormal sensation in the chest, which is usually a form of pressure or heaviness or like a band around the chest, which is difficult to localize. A person feels it is a disagreeable symptom. He does not realize where it is. It is like a heaviness. It can be anywhere from the lower jaw up to the umbilicus. It can be anywhere. It does not necessarily have to be around right arm or left arm. This left arm business is a myth. More pain in the left arm comes from cervical spondylosis than the heart. And this sense of disagreeable sensation in the chest, this person continues to walk. After some times, he finds that his breathing becomes hard and labored, and he finds it difficult to keep pace. So now you have a abnormal sensation in the chest, and you have shortness of breath, and you have light sweat which breaks out. Now this gentleman cannot carry on any further, so he takes off his weight and sits down. After 2 to 5 minutes, this disagreeable sensation in the chest improves. He recovers his breathing, and he is now feeling more comfortable. 1778. Brilliant clinical description. William Heberden. This description is applicable even today. Doctors make mistakes with their own chest pain. They land up late. But this is the same pain if it does not go away on rest. You see what he has told you? It has to be a smoker. So he has defined the pre-test probability. A smoker, heavy set, middle-aged. After a heavy meal, walking uphill. He has described that, all these things. Abnormal heaviness, sensation in the chest, pressure. With what? With some amount of shortness of breath and some sweating, which is relieved on rest in 2 to 5 minutes. This is the description of stable effort angina. But is angina always only on effort? No. You can have non-threshold angina. You see, this is an angina which occurs on a fixed threshold. कि आपको अगर treadmill में 3 मिनट पे होता है. But you can have non-threshold angina, and when non-threshold, it may not only be a blockage, it can also be a spasm which causes in the vessel. And when this pain continues for more than 10 minutes, it can be actually the pain of a heart attack, of an acute myocardial infarction. This pain is usually not localizable by a finger, or so when patients come to us, they say, "Doctor, bhari tight ho gayi, chhati bilkul." When I talk to my patients and I ask them, "Aisa सीढ़ी चढ़ते हो तो छाती भारी हो जाती है?" I don't ask them दर्द, because they will say दर्द भी नहीं है. But जब वो ज़्यादा amount of heart damage होता है, heart attack होता है, तब वो it is the worst pain which a person can have, and that along with that pain is a description again from Greek called angor animi, which is an intense fear also happens in these patients. So this is a classical description. We should, if this pain has happened and it is lasting for more than 10 minutes, you all have my cards. God forbid, if you ever meet, you can give a call. Try to sit, or if somebody in your neighborhood has this pain, try to make him comfortable on a chair. Try to make him just sit down. And if you have a tablet of aspirin, which is there usually in everybody's house, make him chew it. In fact, preferable not to be ecosprin. It can be just aspirin. Just make him chew it. If you have Sorbitrate lying, half a tablet of Sorbitrate, put it under his tongue. If the pain continues for after 1 or 2 Sorbitrates, please ring up any emergency number or our emergency number. Ask for help. Because if it is a heart attack, then this can damage a lot of tissue. And today, we have the expertise that if we treat this promptly, we can prevent the damage. In the 80s, we started doing it by giving clot-busting drugs. But we realized that the best clot-busting drugs open only about 54% of arteries. But today, we do a direct angioplasty, what we call a primary angioplasty. Go in, do an angiogram, realize where the blockage is, put in a wire, put in a catheter, suck out the clot, put in a stent, open the artery, you're done. That's called a primary angioplasty. So that is actually, it can prevent the heart attack happening completely. It can prevent damage, and that is what we need to understand. We need to educate the public, we need to educate our neighbors, we need to educate everybody about this. The other symptoms can be rapid heart rate. Palpitation is defined as an uncomfortable awareness of one's own heartbeat. It can happen because of rapid heart rate, it can happen because of rapid irregular heart rate, which I said is because of atrial fibrillation, it can happen because of increased force of contraction. The other symptoms is people who faint often. Now every fainting is like a mini death. Of course girls faint in school assemblies due to heat or something. That is a common faint. But when a faint happens in a patient who has heart disease, it can be a very sinister prognostic importance because it can be a manifestation of ventricular tachycardia or it can be a manifestation of complete heart block. So we need to look at that very, very carefully. And your question was, how does one know that one's heart is weakening? Now, if one has got a normal heart, one looks for these cardinal symptoms. But if one does not have a normal heart, one has a diseased heart, and we want to know we are getting worse, we look for it by our effort tolerance. If I can walk 2 kilometers today, am I finding it difficult to walk 1 kilometer tomorrow? Then there is a problem. I need to know whether my feet are getting swollen. People who have weak hearts and heart failure, we tell them to monitor their weight daily. Because for feet to be swollen, it also needs 5 liters of fluid, extra fluid to be accumulated in the body. So if you are monitoring your weight, you can pick these up early. It also, we need to understand that if a person was happy with 1 pillow, if he now needs 3 pillows, it can be because he's getting orthopnea. He's finding it difficult to breathe. So these are how we assess whether a person's heart is getting weaker. Yes, sir.
So what about side effects of medicine? For example, following a CAG where there was a very limited blockage, you normally advise the prescribed blood thinners. So one has been taking Cervin 75 for say 3 years. Can it cause some side effects like additional red?
Firstly, I don't think there is much reason for you to continue. Cervin is actually clopidogrel for beyond 2 years. I don't think there is any great data that it is useful even if you have a stent. So we need to check the appropriateness of practice. Yes, you're right. There is no medicine without side effects. And we have to walk this tightrope. We have to understand that which side, why do we need a drug? When we do an angioplasty and we put in a stent, we are placing a foreign body. When we started doing angioplasties, we realized that these stents can sometimes clot off. And the key figure in this clotting is the platelet, which is the clotting cell of the blood. And we need to suppress this platelet activity. And that is why we make it mandatory to give aspirin and Plavix. Plavix is the actual name, clopidogrel or Cervin, whatever you call it. These days we are changing because even Plavix or clopidogrel had 30% resistance to this drug. So now we are, and more people, especially people who come with heart attacks or who are diabetics, as long as they have not had any strokes, they have not had any, don't have low body weight, we use drugs like prasugrel or FEN. We use them along with aspirin. It is mandatory after a stent for the first 6 months. In fact, if somebody has to have an elective surgery, we tell them to postpone that elective surgery. After 6 months, we don't have great evidence that it really helps. And certainly, the guidelines today say 1 year. We don't say more than 1 year. More than 1 year, we only say if we identify a specific risk factor. So you don't need to take it for 3 years, for sure. Okay, that is one thing. But you must go back to your physician because he may have identified certain specific risk factors. But every drug, statins gives rise to muscle pains, clopidogrel or you're using can give rise to an increased rate of bleeding. So we get into trouble because you've done an angioplasty and you've given aspirin and clopidogrel and the patient develops an upper GI bleed for some ulcer that has got activated. Now you're in trouble because you don't know how to balance this tightrope. Because you put in a stent, you have to continue aspirin Plavix, otherwise the stent will clot off and the person will die. So you treat the ulcer locally. So these are the things which have to be individualized. So there cannot be one unique recipe for everybody. This is where the role of the physician. If everything was to be answered by the internet or one algorithm, there would be no need of physicians.
So, but does it cause higher red blood cells in this thing?
No, so it causes, because if there is any bleeding, because the platelets are now weaker, it will not cause clotting. So if you have a bleeding for any reason, like an injury, you can bleed more. So people have, that is why we are not continuing it lifelong. That's why we continue it when the risk is there, which is maximum in the first 3 months, maybe 6 months, not beyond a year or 2 years. We don't have to continue it lifelong. And as people get older, you may have abdominal surgery, something else, so there is a risk of bleeding. So that's why we balance it out. That's why I said it's a tightrope walk.
What about a thing like ecosprin? Say ecosprin or different stents between the two?